during your period. So tonight, I'll be talking about what causes painful periods and how it can be treated. So join me and let's start. Okay, you realize that, let me just quickly, I forgot to set up my video camera, so it's just recording now. So the video for YouTube is recording now. So let's start. Now, like I said at the beginning again, if you just joined in, my name is Dr. Alalade Babajide. I said again at the beginning that the body has two types of muscle: the smooth muscle and the striated muscle. The striated muscle is the one you control voluntarily. You move your hand, you smile, I spark my cheeks, all those muscles. I'm walking. They are the muscle under your voluntary control. You control them consciously. The other muscles in your body, we call them smooth muscles. Those ones you don't control. The example of a smooth muscle is the muscle around your womb. Your womb will contract during labor, not your control. It starts automatically when the womb is ready to get the baby out. The same way too, the womb will contract to expel the period blood. The womb is muscle. You can see this red part, that's muscle. It will contract while the womb is contracting to expel and to push out the blood from period. Is contracting. That action of contraction is cramps, and it can cause severe pain for women, and is the number one cause of pain during period. That's number one. Another possible cause of painful periods, okay, is ovarian cyst. Some people do have ovarian cysts, yes, and sometimes it will cause pain during your periods too. Another possible cause of pain during your period is your fibroid. Your fibroid is part of your womb, okay? There can't be fibroid when there's no womb, ideally. For you to have fibroid causing you pain, that means that you already have a womb. Because fibroid arises from smooth muscle of the womb. Now, if you have fibroid, okay, in your womb, definitely it will increase the surface area of your womb. People that have fibroid, they have bigger wombs than normal. If your womb is going to be like the fist of my hand and you have extra tissue, fibroid attached to it, the womb becomes bigger. So when the womb is contracting during your period, to expel the blood of the menstrual blood, the fibroid will be contracting too, and the pain will be increasing. So fibroid is another possible cause of painful period. Another possible cause of painful period is adenomyosis. People always ask me that question, doctor, what is this big grammar called adenomyosis? Don't worry, we'll start writing these things on the board soon, and we'll start creating space for that, so don't worry. Adenomyosis is ADEMYOSIS. Is basically, when you look at this womb I'm showing you, you see that this womb has three layers. The brown outside part that is always in contact with your intestine. The red part, which is the muscle of the wall of the womb, that is the wall inside of the womb. And there's another layer of the womb, which is pink inside here, like my lips. I always tell you that pink area inside the womb is the one that bleeds every month, month in, month out. Your period is coming, it will bleed. For some reason, in some people, this pink part of the womb that is supposed to bleed out every month will sometimes find their way into the wall of the womb. That is why if you look closely on Instagram, you see some part of this wall of the womb, they are black, painted black spots. The same thing too here on YouTube, you can see some black spots painted in the wall of the womb. And you can see here on Facebook here, wonderful people, black spots inside the wall of the womb. That is adenomyosis. And how did they become black? How did they get there? For reasons I don't know. We don't know completely in the medical world. To this part of this womb, this pink one that normally bleeds out, will for some reason move inside. It can happen, for example, during D&C, where we are scraping the wall of the womb to expel the pregnancy. Sometimes those wall of the womb can move inside. Sometimes during C-section, we're trying to stitch your womb, we can implant and bury that layer inside the wall. It can happen. But sometimes we don't even know. Some people, they didn't have CCS before, they didn't have D&C before, but they have it like that. It can just happen. It can happen. So when this wall of the womb move into this layer of the womb that bleeds out, moves into the wall of the womb, it will stay there. But because those ones that have moved inside the wall of the womb, where they're not supposed to be, they will also respond to the ovary every month, telling them to bleed with your period. But because they can bleed out, the blood will collect there and will become black. It's old blood. That old blood makes it black. That old blood makes it black. Sometimes too, this same mechanism, the cells in this tissue, this inner cover of the womb inside here, can move outside and can go and implant on your tubes. You see those black things on your tube too? Or even on the side of the womb here, you see? Those ones, when they move outside, we call them endometriosis. If they move into the wall of the womb, we call them adenomyosis. Both of them, they are brother and sisters. Adenomyosis and endometriosis, they are painful. What? I said they are painful. So during your period, you're supposed to bleed out. But because these ones, they can't bleed out, they will swell in the wall of the womb, wherever they are. They will swell there and they will cause pain, which starts so bad few days before your period starts. And as soon as your period starts, the pain will start to subside. The same way too, their sisters here, endometriosis, will behave too. They will swell when your period starts, and as soon as the period is getting settled and over, it starts to shrink back. That's endometriosis and adenomyosis. They can cause painful period. Another cause of painful period is what? Infection. Infection, sometimes chlamydia, gonorrhea, syphilis, even staph aureus too. Very rarely they can cause painful periods too. That is why if you want to check yourself and you're having painful period, the first thing you should do when you go to our ATG laboratory, you can call them on Monday and speak to the lab manager, Nike or Cynthia. They will tell you what test to do. I've given them instructions. If you call from ATG, as soon as you get your test done there, they will give you my link to send your results to me from the laboratory, and I will review your results with you. Even the fact that you're not an ATG member, you just go to the laboratory. You don't need to be an ATG member or ATG subscriber to our any services for me to get your results reviewed, but they must be done through the laboratory. I have assurance because it's our ATG laboratory. Another possible cause of painful period, I said again, is fibroid. Fibroid can be seen by ultrasound scan. On ultrasound scan, we'll pick up fibroid and we'll tell you how many it is, where they are, because some fibroids can be inside the wall of the womb. You can see those ones there. Some can be outside the wall of the womb. Some can be even in the cavity there or on the cervix, and they can cause painful period. Another cause of painful period is what? Endometrioma. You see those endometriosis there that I was showing you earlier? They can also implant on the ovary. And when they implant on the ovary, they'll cause blood to stretch on the ovary. Okay? It can, because they can't bleed out. Like I said, they can't, like the adenomyosis inside here, like the adenomyosis here, endometriosis here, and the endometrioma, which is the endometriosis on the ovary. They can't bleed out. But with every month cycle you have, it will stretch, shrink small, stretch. But they will contain old blood, just the same way those black spots contain old blood. They contain old blood. And that old blood will be so thick and it will form a cyst on your ovary, what we call endometriotic cyst or endometrioma. They can be very painful. And I've seen ladies before that we have to go and remove those cysts from them through keyhole or through open surgery. Another cause of painful period is if you have your ovaries are torted during your period. You have ovarian torsion while you're having a period. That can happen too. Okay. Another cause of painful period, okay, I said again, is infection. Infection, if you're thinking that you're having offensive discharge down below, get vaginal swab. Get your cervix swabbed, okay? Get your vaginal swab, your cervix swabbed, and also ensure that you are doing your pap smear every 3 years so that if there's any sign of cancer on your cervix, we can pick them up. I released a video on YouTube about a week ago talking about cervical smear, and I made it very clear and also explained the difference between cervical smear and the difference between cervical swabs. Every woman listening to me today must know the difference. This is the gospel of your body. You must know how your body functions as a woman. You must know how your body ticks as a woman. That would ensure you get the best from your service. In fact, imagine you're going to see a doctor. The doctor is saying something and you're able to understand what they're saying. I'm not saying you should be rude to them, but anything they mention, you're able to make it sink in. It makes sense to you because you've been in this ATG class. If you're an ATG, definitely if you enter into your church, if you enter into your mosque, you're in that women's association, in your Rotary club, or in your at work. When people say something, you'll be able to contribute and give them concise advice. And worst case scenario, you can tell them to come and meet me ATG, and I will guide them. So many women have been to me this week. They've been tagged to my name in their own separate groups where they had a medical problem, gynecological problem, and their friends tag my name there that they come and speak to me. And it's always a pleasure to speak with them. And definitely too, we've also presented in many groups online last week about ovarian cysts causing painful period. Okay, so so how do you treat painful period? Number one, if you have an infection, we need to know what infection you have and we treat it. Once we treat the infection, the painful period will subside. Number two, if you have fibroid on your scan, in most cases, if it's bigger than 4 or 5 centimeters, it can cause painful period. Sometimes it might be a good idea to get them reviewed and rescanned again. And if they are getting bigger in size, it might be a good time to consider taking them out by a well-qualified surgeon that knows what he or she is doing. Another cause of painful period, like I said again, is endometriosis or endometrioma. Unfortunately, we can't see endometriosis on scan, but we can see endometrioma, that is endometriosis cysts on your ovaries. We can see them on scan. For us to see such cysts on scan, this endometriotic cyst on scan, it means your endometriosis is so bad. Definitely, if you have severe bad endometriosis, it must be removed surgically. It can be done through keyhole, it can be done through open surgery, and once it's taken out, it resolves. Another thing we can do is to give you simple painkillers during your painful period. They can help. Some people, just by changing their diet during their period, it helps to relieve them of painful period. And sometimes to just taking simple analgesia, paracetamol, ibuprofen if you don't have ulcer, or ibuprofen if you don't have asthma. If you have asthma or ulcer, don't use ibuprofen. Don't use the diclofenac. Stick to your codeine phosphate. Stick to your paracetamol. They can help you. Another thing we can do is if you have painful period. Another thing you can do is if you have painful period. 1 second. My mouth is dry. You know, this is our talk. It's like as if we are preaching in the church or in the mosque. It's not easy. Anyhow, friends, let's keep talking. Another thing we can do if you have painful periods, okay, is that we can put in a coil. If you have painful periods and you're not desiring to get pregnant at this point in time, or pregnancy is not your plan for now, we can do one thing for you. We can give you contraception. By giving contraception, we can make you skip some periods. Instead of you having 10 to 12 periods in a year, we can make you have about 3 periods in a year medically. And that will reduce the frequency of your pain. That will reduce pain from your period during your exam. That will allow you time to concentrate on your exam. You can focus on your job interview because that pain is taken away. We can give you contraception. Yes, it's safe for a while. Maybe we can give it for a year or two to give you relief. You can also put what we call Mirena coil in your womb, which also works as contraception and also helps to reduce pain for your period. Those options are for you if you're not planning to conceive anytime soon. They are safe, we do it all the time, and they are one of the good options, one of the best options for treating painful periods. Now, I'm going to open the floor shortly. I have Awele Johnston here, Mag Han, Elizabeth Asemota Odumos. We have Rachel Joy Inkichi, and Chidima Oji, Jockey Africana. Now, I said again, if you have any gynecological concern, infertility issue, just walk to AT Laboratories. The address is already on the screen, and get your test done. While you're doing your test, okay, once you have the result, tell my lab managers or the people in the laboratory, you need my number. They'll give you my number, and you can forward your results to me on that number, and I will give you your results free of charge. That will save you the hassle of going through any other doctor. Easy access to ATG doctors. So a lot of people obviously listening to me, they have questions, they have things bothering on their mind, they have this and that. They want to talk to somebody. I'm here for you for that purpose. You can go through our premium services. Definitely, you know, we have the weekly consult, we have the one month consult, we have the gold consult, the diamond consult, and the new platinum video consult, where I can talk to you live, video, one-on-one, if you want. Let's go back to question and answer session. Yeah. So if you have any questions, bring them up. Let us trash them. Let us dissect them. Let us dissect them. Let us pieces them And because by the time you ask a question, somebody listening to me, listening to you, will probably get answers to their own peculiar concerns or questions as well. Somebody will ask me a question: can painful period cause infertility? No. Yes. It depends on what is causing that particular painful period. If, for example, you have endometriosis that is causing your painful period, and that endometriosis is so bad that it's damaging your tubes, it can affect you and cause pain in your period, and also reduce your chances of conceiving naturally. If you have fibroids that is causing your painful period, and those fibroids are in a position in your womb that they are blocking the tubes, they can block the tubes or even disturb and disrupt implantation, and that can cause infertility. If you have infection like chlamydia, gonorrhea that is causing your painful periods, and that infection ascends and moves into your tubes, so infection from chlamydia moves from vagina through your womb into your tubes, and it causes damage to your tubes on both sides, it can cause infertility. That is why if you have any infection or whatever in your vagina, you need to get them treated without delay. Candida infection does not cause painful period. Okay, chlamydia, gonorrhea can cause painful period, and they must be treated as soon as possible. Someone is asking me a question on Instagram: does adenomyosis affect fertility? If yes, how? Adenomyosis does not affect fertility in most cases, but in few cases it can cause adenomyosis. Usually, if you see them, they're not being in only one place, they'll be all elsewhere as well, and usually too they're associated with endometriosis. And if you have endometriosis, it can cause infertility. Yes, so adenomyosis can cause secondary infertility. Ebony is asking here on Instagram: what is the reason for blood clots during period? When should you be concerned? Ideally, the way God made the period blood is that it does not clot, it flows out. In fact, your bleeding for your period contains some natural anticoagulants, and they don't clot. By the time you're having blood clot in your period, it means your period is too heavy. If you're having blood clot in your period, it's already a sign that your period is heavy, and you should be concerned at that stage. If you're having blood clot in your period automatically means it's saying that I am too heavy. Heavy bleeding is equals to clots in your period. Clots in your period means you have heavy bleeding, and it is too bad, it must be sorted. Please, my people, listen to me. A poster goes up today, please. If you notice blood clot in your period, it automatically means your period is too heavy and it should be checked, it must be fixed. So my sister asking me on Instagram, if you can see blood clot in your period, it's heavy enough. First things first of all, to check your blood level, your full blood count level, and to check your platelet level. All this can be done straight away from you automatically, 4 minutes in ATG laboratories, and you have your full blood count, your MCHC, your MHC, your platelets, white cell count, everything completely. Okay, yes. So heavy bleeding, you see clot in your bleeding, it already means that your period is too heavy. Okay, I'm looking for questions online here. Where is the scan center? So I have Shogba Muwura. She's asking, where is ATG scan? My sister Elizabeth, I think you're on Instagram. Can you help me put the address of our ATG scan center on Instagram, so that Shogba Muwura can see and can get the scan center? You can walk there tomorrow on Monday morning, and there's a lady there. She'll scan you and she'll give you how to get details of how to get your results to me, so I can review your scan. If you're pregnant, you're trying to get pregnant, or you're having heavy bleeding, you have a family history of kidney stone, liver problems, gallbladder problems, appendix pain, anything in your tummy, you need a scan, walk to ATG center and they will scan you there and they'll give you your report. And automatically, once you do your tests at ATG center, at ATG Fertility Laboratories, you have to consult me to go through your results, and I'll get them done with you as soon as possible. Once you send your results to me on my WhatsApp phone, I review your results and I get back to you within 2 hours, all things being equal. Okay, so let us take more questions here on Instagram. Thank you guys for joining here on Instagram. God bless you. Much love to you all. Thank you, Shalewa, my sister, beautiful sister, for putting the address link for the laboratories for the lady on Instagram. asking that question. Immaculate Atejezra, thank you so much. Wherever you're from, you're wonderful. We're happy to have you here. Princess Edith Madojemu, Mag Ann, Fumirita is Sume, wonderful. Ngozi Miriam Honora, thank you so much for joining this out. I know it's a Saturday, so for you to be here is always a pleasure, and I am happy to be your host today. And thank you once again for spending your time and your data to join me online here. It's a pleasure, and I respect that, and I value that so much, and I take that not for granted. So we stay open here for our open session for question and answer. Zika Ikedima is saying that there's a at present we don't have a branch in Abuja, but we're going to get a branch there soon, but not yet. We just opened the one in Lagos, and we're just going to open the center for the ATG IVF center. So we don't have a laboratory yet in Abuja, but we're coming there soon. If you're pregnant, don't wait to have a miscarriage before you know that we have antenatal. I've seen people come to me on my phone. Well, last 2 days, about 5 people, they had a miscarriage. They were sending me message on Messenger. As much as I feel sad and I empathize with their situation, I want to tell you that don't wait for that unfortunate thing to happen before you join ATG Antenatal. We have an antenatal arm here on ATG. Dr. Esther manages that under our supervision. And also, we have the GTC, Getting Ready to Conceive, which is also a group on Telegram. The antenatal and the GTC is on Telegram. The GTC is Getting Ready to Conceive. We open the floor and we discuss all your situations there in the open group. If you want that one-to-one consult, X that group. You can join the premium services. We have the consult, weekly consult, 2,750. We have the 1 month consult, which is 6,999. Okay, sorry, which is 4,005. So apologies for that. We also have the gold service, which is 16K for a full year. We also have the diamond service, which is 20 grand for a full year. We also have the new platinum service, which is 28,000 for a full year. The platinum service, you can see me on a video like this. I talk to you live. For the diamond service, we talk together if you want on diamond phone call, on the WhatsApp phone call. It's also for a year. The gold service is 16K. You can talk with us for a year, chatting, okay, chatting on WhatsApp. From gold and above, you have access to seminar. Gold, diamond, platinum, you have access to our monthly seminars for a year while you're registered. Thank you, Shugba Mura. What causes stomach cramps before period? I was explaining Shugba Mura. Stomach cramps before period, okay, is usually, if it happens mid-cycle, is from you ovulating. If your period is causing you pain, usually you have stomach cramps around the time of your period. It's because the womb is contracting. And we can give you some medications to slow down the contraction of the womb. The womb must contract during your period to force out the old blood. Somebody's asking, what causes bleeding for 3 days mid-cycle? If you're having bleeding, okay, not at the time of your expected period, we call it unscheduled bleeding. Any bleeding that is unexpected, any bleeding from you that is unscheduled. Scheduled bleeding means your regular bleeding. Scheduled bleeding means your regular menstrues. Scheduled bleeding means expected normal period. If you're having bleeding after your period has ended, or you're having bleeding just before your expected period, is what we call intermenstrual bleeding or irregular bleeding. For such cases, for such situation, you must be reviewed. Number one, the first thing you must do is to check for infection by doing proper vaginal swabs and endocervical swabs done for you. Number one. Number two is to do what? Scan you to check for fibroid, to check for cervical or endometrial polyps. This can cause irregular bleeding. Another thing you should do is to ensure that you're having your regular pap smear. By not having your regular pap smear, you are increasing your chances of cancer of cervix, which can kill easily, which you can easily prevent if you do your regular pap smear. Once we've done all this, the next thing we do, like I said, is to do ultrasound scan to check your womb cavity, to check your womb fibroid if you have anyone, or to check your cervix for polyps. You must get examined for this. And once we've done all that, You might also need to even do your hormone profile to see if there's any possible reason why you're having this irregular bleed. Okay? Thank you, Shugba Moga. Thank you guys for joining today. I can't see much questions on Facebook here. I think Facebook is not allowing me to see questions here on Facebook. So if you send questions to me here on Facebook, it's not my fault. Oh, can you believe it? There are so many questions here on Facebook. It's just popping up. So if I've not seen your question here on Facebook, I'm just seeing them. Apologies. Now let me start trashing them. Good. Abiriba Magic Lady, she's saying that when is the best time to do urine ovulation test? The best time to do urine ovulation test is around your ovulation day. And how do you know your ovulation day? You first of all know your cycle length. How do you know your cycle length? You sit down, take your phone, think and remember the first day you see bleeding in your last cycle. Okay, count how many days in between till the next day you see your first bleeding for your next period. So the first day you see period on your last cycle, count how many days between till you get to the first day you see bleeding in this your new period. If you get that, that is good. Do that again for the last 2 or 3 menstrual cycles. Once you do that, you know how many days you have between in each of your menstrual cycle. Now divide that day amount, maybe 30 for example, into 14 and 16. Okay, 16 first, 14 second. The second one, which is 14, must always be 14. So the first one will be 16. If you have a 29 days menstrual cycle now, you'll be 15 and 14. If you have a 28 day cycle, 14 and 14. If you have a 27 day cycle, 13 and 14. That means that you'll be ovulating on that day 13, 14, 15, 16 respectively of your period. So for example, if you have a 30-day cycle, you'll be ovulating on day 16 of your cycle. If you have a 29-day cycle, it will be day 15 of your what cycle. That day 16 or 15, depending, can fall on any day of the month. It does not have to be 16 of that month. It can be any day of the month, depending on how you're counting. Okay, so once you get to that particular day you've noted for your sake, for yourself, you do your urine ovulation test there. But if you are doing your urine ovulation test, okay, and that is a sign for you to go and do sex for pregnancy, you're wasting your time. For you to get pregnant, don't rely on doing ovulation test alone. What you must do, as I've always said, is that you can do your urine ovulation test, but you should ensure that you're having regular sex. The only time as a lady that you're free from sex, the only time you're free from sex is during your period. Every other time, you must have sex regularly every 2 to 3 days. That will increase your chances of getting pregnant from 40 to almost 90%. Okay, that's for Abiriba Magic Lady. Thank you, Vivian Diko Briggs, for putting that link for gold service up there. Thank you, Gloria Nwako Konji. Goodness Madu. Doctor, once I take medication to ease the pain before my period, it automatically shifts to my period by a few days. The pain medications for your period does not shift your cycle. Taking pain analgesia like paracetamol to treat your painful periods does not alter, does not change your menstrual cycle. Check your moon profile, Goodness Madu, to know if it's your moon profile that is messing things up. Ayo Vaughn Ayobami. Good evening, doctor. Please, I want you to shed more light on this. Sir, I saw my ovulation mucus on the 28th of March. My period is 3 days late. When I squeeze my breast, milk does come out. You did a hormonal profile test or home pregnancy test. It came out negative. What do you advise? I would advise you repeat your test of pregnancy next week. Repeat your test of pregnancy next week. And then get back to me through the premium services. That is for Ayo Vaughn Ayobami. Giselle Inji, doctor, what does folic acid harden stool? Folic acid, sometimes like iron tablet, can harden your stool. That is why if you're taking folic acid or iron tablets, okay, or together, always ensure you're increasing your water consumption to at least 2 to 3 liters per 24 hours minimum. And also eat fruits that will soften your stool. Increase fruits that contain water. Fruits that contain water like orange, like purple, like melon, foods like that, they contain lots of moisture content, a lot of water. Eat them. They help to reduce constipation. Okay. Ngozi Efediwa, thank you for watching. Debbie Thompson Uhiene, good evening to you too. Adolphus, can bulky uterus cause painful period? Yes. Bulky uterus can cause painful periods. Yes. Can it affect you from getting pregnant? It may be. If your bulky uterus is from your fibroid, and that fibroid is causing your womb to be bulky and is blocking the tubes from entering the womb, it can cause infertility problems too. Yes. Precious faith. Can someone whose left tube has fluid but right is okay get pregnant? Yes. If you have one good tube that is perfectly okay, your chances of pregnancy is 67%, as opposed to 100% if you have two perfectly working tubes. With only one good tube, you can get pregnant, and any of the ovaries can release the egg. If you have one perfect right tube and you ovulate from the right ovary or from left ovary, it will pick it up. Okay, you only need one tube to get pregnant. But if the other tube is damaged and you get pregnant with one tube, always do a scan at around 5 or 6 weeks to check for ectopic pregnancy, because if you have a blocked tubes, your chances of ectopic pregnancy is much higher than someone that has no blocked tubes. Sheena Johnson Adokie. Good evening, doctor. What is the cause of delayed period? Usually hormonal imbalance. That's the honest truth. The cause of delayed period could be hormonal imbalance, which could be premature ovarian failure. You're not ovulating anymore. You have high prolactin level. You have high FSH level. You have high level of prolactin. They can cause imbalance hormones, and they can make you to have delayed period, or even pregnancy. Pregnancy can make you have delayed period. Honestly, I've seen people that say, I've not seen my period for 2 months. They didn't even know they were pregnant already. So do your test of pregnancy is important. Thank you guys from on Instagram. I can see you live on Instagram. God bless you. Is it possible for scan not to detect pregnancy? It's possible. If you do scans very early, around 4 or 5 weeks of pregnancy, it could be difficult for scan to pick up pregnancy. But if you do scan from 6 weeks onwards, and it's a good scan and it's done by a good professional, they will pick up the pregnancy. In very rare circumstances, very rare, maybe 1 in a million, they will not see the pregnancy, but that is very rare. If you are pregnant from 6 weeks and above, the scan will pick up pregnancy. Even the scan that is done in the bush of Africa, they will pick up that pregnancy. Okay, that is it. They will pick it up. Sanusi Adebisi, that is your you. Talosi, so that's your answer. Devin from Togo, wonderful. Doctor, do you have a lab in Enugu? No, ATG laboratory is only in Lagos. ATG laboratory is only in Lagos. We're coming to Enugu soon. We're coming to Abuja soon. We're coming to Port Harcourt soon. We are only in Lagos for now. We're coming there soon, okay? Doctor, I would like to know why I always have severe migraine on your right side of your head during ovulation. Some people have been known to have headache during ovulation. We call it catamenial headache. Catamenial headache. It can happen. It's the progesterone level that can sometimes trigger the brain to have headache. It's true. What we can do is to give you painkillers. We can give you some stuff for migraine relief medication. We can also give you contraception to reduce the frequency of your periods. Okay, your period is late 10 days. Something I can't see your question again. Your period is late for 10 days. You haven't painful nipples. You continue during period. What is the cause? Maybe hormonal imbalance, maybe high prolactin, maybe you're pregnant. Okay, our office is in our Lagos, not in Port Harcourt. We don't have office in Port Harcourt yet. The only office we have in ATG currently now is in Lagos. It has a IVF center and it also has a laboratory. If you want to do any of your laboratory tests for infertility, just call the laboratory on Monday morning and talk to Nike or the Cynthia. There are 2 people there. They will tell you what test to do. They'll give you the cost, and they even give you directions on how to get to the laboratory. And once you've done the test in our laboratory, they'll give you my number so you can forward the results to me on my WhatsApp line, and I can trash, review, consult you, advise you on what steps to take with the result you've given to me. But if you don't give me results, I'm not magician. No? I can't do anything. But if you give me results, I can advise very, very well. That is what I do. Okay? How can I improve estradiol? First of all, we do a hormone profile to know why it's slow. Once we know why it's slow, then we can work on improving it. Okay, you're above 40. Sometimes someone with ovarian cyst 4 millimeter. If you have ovarian cyst of 4 millimeter, forget about it. Don't worry. But if your ovarian cyst is 4 centimeter, then we have to remove it at age 40. Okay. Thank you guys for listening to me today. I really appreciate it. I gotta go off now and get some lunch. And I hope to see you later today or tomorrow morning to have more chat with you. Once again, I want to say thank you for your time today, for spending your time and data to listen to me, to watch me. I appreciate you. Once more, I want to say I love you and I love myself too. I hope to see you soon too, today or tomorrow morning. God bless you. Have a wonderful rest of your weekend. Bye-bye.
na money.